Hi, I'm Kevin Harrington. I'm with my co-host Forbes Riley. We've seen you on TV for many years as a fitness expert and a television show host.
And of course, we recognize Kevin Harrington as one of the original sharks from Shark Tank. Now, Kevin, you know, I've been sadly in a couple of car accidents throughout my life, and you're finding that you go to a chiropractor or a doctor or a physical therapist.
Yes.
Well, our next guests have done something amazing. They put all of them in one place.
Wow.
I'm huge fans, and I'm actually a patient. And I want to say hi to Dr. Jill Howe and Dr. Jodie Schultz. Welcome to the show.
Forbes and Kevin, thank you so much for inviting us here. We are honored to be here. And between the two of us, we actually have over 30 years of experience in our profession. You know, we are both certified, board certified specialists in neuropathy, and Dr. Howe here is actually a best-selling author.
Nice.
And we've recently added another book to our repertoire that talks about different health conditions and not only how we can help our patients, but how they can give that to somebody who might be suffering and doesn't know what to do about their own health problem. They can actually have a guide that can help them find the right person.
Now, your whole basis is about functional medicine. And one of the things that you've done, you need to explain that to us pretty clearly, but you've also taken the concept of putting disciplines, a doctor, a chiropractor, a physical therapist, and a massage therapist in one place.
Kind of five pillars of medicine, right? That's pretty
genius.
cool. I like that.
Yeah, it's something that I've been working on for the last 15 years. I've been in practice for 25 years, and I was just looking for more things to bring in to help people. We could get them to a certain level, and then we would kind of get stuck. And so we just added more and more practitioners in. But the greatest thing about our office is, you guys have been to the doctor before, right?
Yeah.
And you walk in and maybe they know you and maybe they don't. They look at you like, why are you here? And that window might close and you're wondering, what am I supposed to do? And you sit there for an hour or more waiting for the doctor to come. Well, that doesn't happen in our office. When you come in our office, you're greeted, we know you, we know why you're there. Our whole team has actually met about you before you ever came.
Wow.
Yeah, we have a super powered team of doctors and staff that are working to get to know you. So like you said, we do have our medical doctor, our nurse practitioner, our physician assistant, our chiropractors, our physical therapist, our massage therapist. And when we meet, we discuss you, and then you're gonna be seen by these practitioners, and we're gonna put our heads together so that we can come up with a solution to your problem. Because that's the difference between traditional medicine and functional medicine.
I would imagine that very first visit is the important time when you have all of these experts that have a chance, the medical as well as the chiropractic, taking a look at the patient and saying, together we can solve these issues, whereas a doctor might say they need a prescription or vice versa, other things. So it's a great concept.
Thank you. And that's what functional medicine is. It's getting to the cause of the problem and not putting a Band-Aid on something, actually looking for the reason why. So you could have a headache and take an aspirin or some type of medication, which I'm sure everybody has done, but then they come back. And so it didn't fix the reason why you had the headache, it just gave you temporary relief. So we not only do what Dr. Schultz said, and everybody puts in their own special expertise about what we can do to help you, but we actually educate you. So as a patient, it's important to know what's going on. Otherwise, you have no idea how you can contribute, or if you're doing something that's detrimental to your care and the actual outcome of your care. So we want to make sure you're on board. So we're 110% on board, but we want to make sure the patient's on board and that they know what to do.
Well, if you are a whole person, I'm a whole person. I like chiropractors, I'm a massage therapist, and doctors. I've been to the doctor who says the chiropractor's a quack. I've been to the chiropractor who says the doctor's an idiot. That leaves you as a patient going, help me, please. People fly in from all over the world to your clinic, don't they? Why?
Because we're unique and different.
Absolutely.
Because we do things that no one else does, and we get results that no one else has been able to.
Okay, I'm going to give you a personal testimonial.
Yeah.
I don't do this very easily. I tweaked my knee.
Right.
And I've always had back issues, and I have had the honor and the pleasure of having you work on my body a couple of times. And I am amazed, okay? Absolutely amazed at the results that you get as a chiropractor. Do me a favor, totally out her. Tell me how good she is.
Well, she's my chiropractor. So she's amazing.
She is amazing.
I might be the only one here who's not had any of this.
We can rectify that.
She, part of why I partnered up with her is because of this system that she's been developing over the last 15 years. Because what I saw her do with patients is life-changing, and that allowed me to reach more of my patients and do more for them than I could do just with my own discipline.
You just got all emotional.
Yeah.
Tell me who you were thinking about when you said that. Whose life has been changed?
So we have patients who have something called a spondylo in their back. It's a slip in the spine where the bones shift. They literally move like
Very
that.
painful.
It's very painful, and most people's option is surgery. Well, she brought to me a therapy we never learned in school that I've changed lives. I mean, we are able to move that, and we can prove that by showing people their pre and post x-rays. We can show the difference. But it's not just about that, it's about the quality of their life. People who could hardly walk in our clinics. People are now out walking with their kids, going to fairs, doing things in life they never thought they could do, going on cruises, enjoying their families. And I couldn't do that before I learned a lot of the stuff that she taught me.
So you focus on preventing surgeries, because that obviously is a big step. I mean, some people may need that, but you try to do everything necessary to not have to do that.
100%. And Dr. Schultz is a sponge, which makes it so easy to work together. So our offices are twins of each other. You ask why do people fly in to see us? Because we can't be everywhere. And there is not another office like our offices anywhere on the planet that I know of.
Now, I read that people have come even like from the Mayo Clinic, which is a big testimonial, because there's people who have tried everything. And if you're out there and you're listening and you have tried everything and you think you have no options, you haven't tried everything.
Absolutely.
I mean, when I literally couldn't walk into your office. I couldn't move my knee. I walked out that same day. I don't know what you did. I don't really care. All I know is it wasn't surgery.
Right.
And I felt so amazingly different that I'm out here kind of as one of your cheerleaders going, you need to meet this woman.
And I hope that more people do. That is our goal, is we want to help people, like our patient Margie, who came in. She'd been to the Mayo Clinic, the Diamond Headache Clinic. She had headaches 3 days a week. They'd go away for a day and they'd come back. That's no way to live. Yet she was a wonderful, on the outside, happy person. And so we didn't just look at what's causing her headache. We looked at how is her body functioning, what's not working, that as an end result she has headaches. And by really looking into everything that other doctors don't necessarily maybe consider important or don't put enough emphasis on, we found that she was actually eating something that was contributing to the problems that she was having. So there's 3 types of stress that can contribute to health problems.
Yep, there's chemical stress, there's physical stress, and there's also emotional stress. So chemical stress is going to be things that we take into our body. This can be through the air we breathe, the water we drink, and the food we eat.
Or medications.
Or diet sodas.
Or diet sodas.
Yeah, absolutely. You know, exhaust, cigarette smoke, dyes in our food. And then physical trauma is going to be things that have happened to you. So it might be a slip or a fall. You mentioned car accidents.
Right.
Okay, Kevin, I don't know if you've had any of those things.
It's terrible.
Quite a few, yes.
Quite a few, okay. You know, even simple things like playing sports. You watch a football game, people get hit so many times. Or you travel a lot. Both of you travel, right? So you sleep in different beds. That puts physical stress on your body.
Yes.
And then there's emotional stress. You guys have families, correct?
Yes.
Okay. Is it
Children.
stressful? Yeah,
Yes,
stressful
children.
thinking about your kids or thinking about where they're going to college. That can be an emotional stress. Or maybe for somebody it's finances.
Or maybe it's your health.
Let me tell you something. My stress put me in the hospital with a kidney stone. So I truly come to understand this.
Yeah.
And I will tell you something, that when you are lying in a hospital bed is not the time to find somebody wonderful. There's about preventative and having that conversation, having a team on your side.
Yeah.
You know, in business we have teams, but in health, do we have a team?
No.
So to that end, you guys have written a book. It's called The Superior Solution. And what I like, also simplicity. The 3-step wellness solution. Can you tell me about this?
Dr. Schultz alluded to that a little bit before, evaluating physical traumas, chemical stresses, and how stress in general is affecting your body, either positively or negatively. Too much stress can actually wear the body down, as most of us know. And it's all about finding the solution for you, or the solution for you, which is exactly what we did when I treated you. So
wonderful.
To us, it's not a miracle. We expect it to happen, because we know, just like if you had a rock in your shoe, you know, you can get a new shoe, but if you bring the rock with you, you're going to have pain still. And only when you take the rock out of the shoe do you eliminate the cause of the problem. And that's what functional medicine or physical medicine is all about, is actually really getting to the source of the problem.
So do I need a pile of cash when I come in, or do you take insurance? Okay. Huh?
It is something, insurance does cover the services that we
great.
do. And so the one great thing, and I'm actually glad you brought that up, because the one great thing that we do that's different from most doctors in general, if you go for a surgery, they don't say, Forbes, you're going to end up spending X amount of thousands of dollars out of your own pocket. Would you like us to do it, yes or no? It's just they do it and you get a bill.
Right.
We actually, when we meet with the patient, we educate them and we let them know, this is exactly what your insurance covers and this is what would be your responsibility. So that's
we could talk all day about the issues in the healthcare system, but I like the fact that you're being proactive about this. Now, to that end, you have done something even better. You have a protocol in your office called PX50?
50.
Okay. Tell us about what that does, because this is seriously cutting edge.
So the PX50 is a newer treatment that's been out that helps us to actually regenerate and repair damaged tissues, damaged joints in the body. It also can help regenerate nerves. So people with neuropathy, that is something that there's not a lot of solutions to. And this actually is going into the body and not just putting a Band-Aid on things. It's repairing that tissue. So if you have a torn rotator cuff, like in your shoulder, or for instance, if your knee joint, like right here, your knee joint, this squishy pad, if that's worn out, instead of having to have a surgery where they put in brand new bones.
But I was always told you could not repair your meniscus. That was once you're done bone on bone, you need to have a knee replacement. You're telling us there's a solution?
Yes.
That used to be the case, but this particular treatment can actually help your body regrow this tissue so that you can have the normal stability and mobility of your knee that you may have lost due to arthritis or degeneration or some type of an injury. It's an amazing treatment.
What kind of process and treatment is this? Is this an in your facility type of treatment?
Yes, it's
Yeah.
one time. It's a one-time treatment, so you don't have to keep coming back for it, and it's something that starts working right away. And the effectiveness is up to a year that it's continuing
Well, I got
to.
a beautiful scar here that I think maybe we could have eliminated, so may I have to talk to you about that as well.
Absolutely.
Do me a favor, there's so many people out there who would benefit from this, and I'm so crazy passionate about us getting healthy. Would you mind looking directly at them and telling them about your clinic, how they can find you, and why?
So many people are suffering needlessly. So if maybe you've been somewhere where you felt like your doctor's not listening to you, you don't know what else to do, you're in chronic pain, there's no other options, you're who we want to be helping.
This is a treatment that anybody could benefit from. We are very selective in our clinic, and if we don't feel that we can offer you the best possible treatment, we won't accept you for care. We'll help you find somebody that could help you. But if you are that person that Dr. Schultz just talked about, don't keep suffering. Don't let pain run your life. You could actually start living a pain-free life right now.
Yay.
It's fantastic. I love the concept of being able to come in and have chiropractic and MDs and everybody in one place to be able to take a look at my problem from the very beginning and give me a great answer to solving my problem. So what you guys have done is amazing.
Thank you. And it's specific for you. Like you just said, solving my problem. It's important to you. You may have the same health condition, same symptom, but not the same cause. And until we find the cause, we're just really treating symptoms.
Well, I'm going to champion that you start creating clinics like this around the country, because I know there's not another one of you, but I'm hoping you can teach this to other people, because this is so unbelievably valuable.
Thank you.
Tell me your overall mission. What are you really passionate about? What drives you guys to do all this?
Well, I mean, we want to help as many people as possible. So many people are robbed of their quality of life, whether it's playing with their kids, whether it's, playing golf. It doesn't matter what is your passion in life. When people have health problems, it robs them of it. When they're sick, when they don't feel good, when they have pain, it robs them of that, and it robs their family of that person in their life. If you're suffering as a mom or as a dad, you're not going to be as good of a parent to your children or to your spouse. You're not going to be as good of a spouse to them. And so this allows us to give that back to them.
This is why people are coming from all over the country and from the
It's
other
obvious.
clinics to come to their clinic. You're in Chicago, and 2 facilities in Chicago.
Correct.
Right.
And I want everyone to come. I don't want any, you didn't even know about what we could do. And I want to tell millions of people, I want them all to come to our clinic, or like you said, start some other clinics, because there really isn't a more proactive way to look at your health than what we're doing, than what we've created.
Let me tell you, every time that you put your hands on me to do an adjustment, I feel measurably better. That takes a lot for me to say that, and I'm very proud to, I'm lucky that you happen into my life, because I don't know that I would have been in Chicago or heard about you, so I'm grateful that we can do a program like this so that people can get exposed to you guys.
Absolutely, and thank you for trusting me, because it's very important that you feel comfortable with your doctor, and that's one thing that we strongly aim to do in our clinic, and I really think that we succeed at that. That's the highest compliment we get, is that your staff is so wonderful and caring and very thorough.
We're wrapping up, but just one person that you've given some real transformation to, if you want to mention, one of your clients. Yeah.
So we treat people from all walks of life. I mean, from literally the cradle to the grave. So it might be an infant with an ear infection or colicky to somebody like Margie that she mentioned before. But one of my patients was a 15-year-old girl that remembers being swung around by her dad when she was 6 or 7 and had back pain ever since then. 15-year-olds aren't supposed to have back pain. That's not normal. And so she came into our clinic, and she and her parents were gung-ho about getting her feeling better. she followed our program and our recommendations, and she wants to be a beautician. And so when she got done, you know, she's hugging us and thanking us because we just changed her life. She's 15. She's got hopefully another 80 years to live.
Right.
And now we just changed her life. And that's what we get to do every
Look at
day.
her, look at her. I just
That's
love
amazing.
it.
That's
You know,
what
I
we
don't
do
know that
every
doctors
day.
She's
get
very
this happy.
passionate,
Yes,
very
she is.
passionate.
How do people find
People
you guys?
hug us.
I know. I
They're
want to hug
doctors.
you. How do people find you?
Well, they can call us for a free consultation by using the information at the bottom of the screen. That's our contact information, but we offer anybody a free consultation to find out whether or not we might be able to help them.
And I highly recommend that everybody comes to get a free consultation. You've got nothing to lose because
That's
you guys
what we
are
say.
amazing.
What do you have to lose but your health problem?
That's
Thank
amazing.
you guys
Thank
so,
you.
so
Thank you.
It was great having you today.
Thank you. Great to be here.